washing my hands. Hi, my name is Corey. I'm going to be your nurse today.
Hi.
Can you tell me your name and date of birth?
Alexis Balanza in September 25th, 2009.
Perfect. Do you know where you are right now?
Cape Coral, Florida.
And do you know the time or the date?
April 28th.
Okay. So she's awake and oriented times 3. Her appearance, she looks pretty, she has good posture. Her outfit is proper for the weather and the occasion. Everything seems pretty symmetric. She looks pretty comfortable and her affect is pretty normal for the occasion as well. Okay, so I don't have my equipment with me, but if I were to do vitals, I would take her temperature orally, but I could do it temporally, tympanic, oral obviously, axillary, and then rectal. Rectal is the most accurate core temperature, but we usually stop doing that up until people are potty trained unless we're looking for a really accurate core temperature in cases that patients aren't awake and oriented. So for the heart rate, I would take her pulse radially. I would count for 30 seconds and then multiply it by 2, and then the respirations, I would count for the other 30 seconds and then multiply that by 2, which I would not let her know that I'm taking her respiration rate, because when people know, they tend to breathe more different. It wouldn't be an accurate respiration rate. For the blood pressure, I would also take her radial pulse, but I would pump up the cuff up until I couldn't feel her pulse anymore right here. And then I would deflate it, and then I would pump it up 20 more than whatever her pulse was that I stopped hearing it. So if she stopped at 60, I would pump it up to 80. That's just an example. So I'm going to check her hair, skin, and nails. Her hair is evenly distributed. It's full. No signs of alopecia or clumps of hair missing or anything. Can I see your nails? Thank you. So I'm doing capillary refill. Her refill time is less than 2 seconds, which is normal, meaning that she has proper circulation. And then her fingernails are about 160 degrees, meaning that there's no signs of early clubbing. I'm going to pinch her mid-clavicular line to test skin turgor, which is normal. It went right down. There was no tenting or anything, meaning she's perfectly hydrated. So for her eyes, her eyelashes are evenly distributed. Her eyebrows are also evenly distributed, and they're nice and full. For her eyes, I'm going to pull down her eyelid. Her sclera is white and moist, and her conjunctiva is clear. So if I were to do the Snellen chart, I'd have her cover one eye. Can you cover the left eye? Oh. All right, can you read this?
L-E-R-N-G.
And then can you cover the other eye and read it backwards?
G-N-R-E-L.
All right, and that tests cranial nerve number 2, which I would also stand at 20 feet, but I can't really get 20 feet away right now. And then I'm going to test her accommodation with my little hot dog light. All right, so can you look straight? That means her eyes are reactive and they accommodate to light. And then I'm going to test her 6 cranial points, not cranial, cardinal, sorry. And that is going to test cranial nerve 3, 4, and 6. All right, so can you, without moving your head, can you follow this? Good. Okay, so her ears. Her ears are, can you keep your head straight? Thank you. Her ears are even. They look about the same size. They're symmetric in color and shape and size. Does this hurt at all?
No.
No.
Nope.
Okay. No pain, no inflammation, no redness. If I were to test an adult look at their ear with an otoscope, I would pull it up and back, and with a child, I would pull it down and back. And the tympanic membrane should be pearly gray and shiny. Okay. And then I'm going to test her nostrils. You want to hold one nostril and smell? Can you smell it?
Yep.
Okay. And hold the other and smell? Perfect. That tests cranial nerve number 1. Going back to the ears, if I were to do a whisper test, I would stand about 3 feet behind her, and I would whisper 3 unrelated words with behind her 3 feet.
Ball, beach, car.
Perfect. So I would do 6 words, 3 in each ear, completely unrelated, and that tests cranial nerve number 8.